This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches.
Hey guys, welcome to Healthcare Snitches.
Yes.
This is episode 15.
15. I think we know this time is episode 15.
We had to go on and calculate what we did last time, what's in the bank, carry the one.
Right.
And came up with 15.
Yeah. 15. So, she's not going to do his bark during this episode, okay? He was trying to tell y'all to make sure that you like and subscribe on our YouTube channel. Also follow us on social media and turn on your notifications so that you get alerted when we post new episodes. And every other Sunday on YouTube, Apple Podcasts, and Spotify. He's in the episode now. Tell your mother, tell your father, tell your baby daddies,
your dog walkers,
tell your mailman,
your mailman's wife that you might be messing with.
Not the wife. I think that they were just messing with the mailman.
Whatever. It could be the wife.
Right. Oh, tell your butcher, tell your person that does your dry cleaning,
the painter.
Tell your dogs, right.
Tell your dogs since they right here.
Tell your doctors, tell your dentists.
Like we do.
Yeah.
Well, today's episode, guys, is about sickle cell. Mm-hmm. And we're going to also talk about if it's considered to be drug seeking when you're in pain from having a sickle cell crisis. That's Peanut's butt that y'all see in the camera.
I can't.
He's trying to make a U-turn.
And he's trying to make an appearance in this episode.
Say hi, Peanut.
Because we are going to have a special guest.
We are.
And I guess he feels like he needs to be a guest as well. Any other time we're recording, he's in the corner sleeping. Now today, he wants to be here in the mix. And we're also on the couch today, so it could be that could. But we were also on the couch. See, now he done took your spot.
He's in our guest spot.
He's in there. Yep. I'm so sorry, sweetie, but you gotta go. Okay, I know you love us and you really want to be with us, but just go sit over there.
Over here, Peanut.
I tell you, when we film on this couch, and
he is over there. He's out. He is on my leg sleep, guys. Y'all can't see that, but he's on my leg sleep.
All right, go on the other side, on that side. Because our guest has to sit here, okay?
Okay, now his butt is just on me. Let's just let him leave his butt on me for a little bit.
I can't.
Just don't fart, Peanut, because you have farted during some episodes as well.
Yeah, he has. All right.
So today's guest, I'm actually meeting her for the first time, but she's one of Jasmine's close friends. She's very nice. And the topic is sickle cell. So she'll be here speaking about her journey with sickle cell. And so what is sickle cell disease? So it's a group of inherited red blood cell disorders that affect the hemoglobin. So that's the protein that carries the oxygen through the body, right? So normally our red blood cells are like flat disc, but when you have sickle cell, they become sickled. So I guess you can say like a half moon or like
S-shaped?
Like a crescent.
Mm-hmm. Okay.
Yeah, or even like an S shape. Some of them got that going on, yes. Mm-hmm. And it's due to a genetic mutation. What is the genetic mutation? I don't know. Maybe our guest might know that. I'm not sure. Because she's very, very, very knowledgeable about this.
So we're going to let her speak on that because, I mean, you got to research, but.
The cells don't bend or like move easily, and it causes like a blockage, and then the blood doesn't flow properly. So that can cause pain. But another thing that it can cause is, just imagine, right? So our lungs, our kidneys, our heart, everything is perfused, right? So if oxygen is not flowing well, then that means that these organs are not perfusing well. Right. So that's very, very, very dangerous. And sickle cell can be fatal due to organs not perfusing properly. So I'm sure that like organ failure can eventually be an issue, right?
Yeah.
And what I learned while doing research is that this condition affects more than 100,000 people in the U.S. and 20 million people worldwide. So this is something that affects a lot of people. And if you are not in healthcare, or if you don't have like a family member, or if you yourself don't have sickle cell, you really don't know a lot about it. So we have our beautiful guest here today so that she can elaborate and answer some questions. I will tell you that I ate Chipotle before this, and my breath smells. So I'm going to try to keep my distance away from my guest. Hopefully she can sit a little closer to you.
Your breath does not smell.
So are you ready to bring our guest on?
Yes.
All right, Tiffany, come on, Miss Beautiful. She's going to sit in the middle.
You better be in the camera because we don't have time for this.
My breath going to be in the camera.
All right, yes, all mic'd up. I got to remember because I ain't got a mic. We only got 2 mics, okay?
Don't judge us.
This is our first move over a little bit. This is our first in-studio guest, so we didn't really plan ahead for that.
Not the in-studio.
Right, not in-studio, aka living room. Whatever. So yeah, here we are, and I hope you guys can hear me, but I won't be saying much anyway.
So Tiffany, can you just tell us? Well, first of all, thank you for joining.
Yeah,
I do appreciate it.
Me too.
And thank you for not judging my Chipotle breath. But can you just tell us a little bit of what life was like growing up with sickle cell? Like,
well, first of all, let me just get this clarified. I didn't eat Chipotle, so hopefully my breath don't stink. She like, girl, because the way you jump back a little bit. Told a different story. I said, oh, okay.
I can't.
Everyone that has sickle cell is born with it. Yes?
Everyone that has sickle cell is born with it.
Okay.
So a common question, it's really odd when healthcare practitioners ask you, how long have you had sickle cell?
Is it how long have you had it, or are they saying how long have you known?
No, how long have you had it? So, and
who did the body?
They're just not knowledgeable about it, and so they probably feel like
it's congenital. Okay, so you've been asked that foolish question.
I haven't, but other sickle cell patients that I'm am friends with, they've gotten that question, and I've been pretty shocked. Like, what do you mean?
Well, one of the questions that I had for you is, how old were you when you found out that you had it? Because yes, you were born with it, but how old were you when you found out?
I was born with it, so I was experiencing pain from a very young age. My mother basically was the one who managed or assisted me while I was young. Usually, so I can't give you like an age of when I was knowledgeable that I knew I had sickle cell, but I mean, elementary school. I mean, I know,
that's early on.
Were you having like crisis?
Yeah.
Yeah.
So your mom didn't they didn't tell her when you were like an infant, right? I'm sure that they didn't run certain blood tests to see if your cells were sickled.
I think they do run yeah, my mom has sickle cell as well.
But not your dad.
My dad has the trait.
Oh, child. Okay, so your mom has sickle cell. So mommy probably had an eye open like, okay, I need to get my baby checked out.
Because I don't know if I know now they check for it in the womb.
Yeah.
But I don't know if back then they did, even if you had it, if they did back then.
I'm not sure, but my mom knew. My mom knew that I had it. And when I gave birth to my son, they give you like a certificate of approval to say like, hey, your child has sickle cell. So without me even asking, that is a test that they automatically run. I don't know if they do it for every demographic or if it's just like, okay, well, you're African American. It may be likely that you would have sickle cell. We're going to run this test anyway to confirm or deny.
They did it after he was born, or they did that when you were pregnant?
After he was born.
So does he have it?
He has the trait.
Oh, he has the trait. Okay. So if he gets married and if he has a baby with a female who has the trait, that baby is going to have sickle cell.
Yeah. Well, there's a percentage. I don't know what the percentage is, but there's a percentage that maybe the child may have sickle cell. He could potentially. If she has the trait. Now, if she has the disease, the child will more than likely have. It would end up like me. Like my mom has the disease, my dad has a trait. So if they were to continue to have kids, every kid is gonna have. Yeah.
Oh my god.
My mom had told me I had the trait, but then I found out I don't have the trait. But my brother has a trait. Troy.
He does?
Well, she's been telling him that. I don't give her that test for it.
The lie she out here.
She's just going around telling everybody they got the trait because she got the trait. Till to find out I don't got no trait. But it never came into play with the kids, is what I'm saying. But it is in my family, on her side. So she does have issues from having the trait with her red blood cells and all that, anemia. So it impacts her, but it doesn't. She doesn't have sickle cell, so it's not nearly as devastating.
Wow. Okay. Have you ever been hospitalized due to like a crisis?
Oh yeah, tons of times. So growing up as a kid, was often in the hospital. My last big crisis, I would say, was 2022. Thank God.
Okay, so
it's been 2 years.
Okay.
It has officially been 2 years since I've been hospitalized for sickle cell.
Look at God.
And extremely happy about that. Before 2022, I think the last time was before COVID.
So before 2020, it was 2019?
2019. Okay. And then every year, at least twice a year.
Twice a year?
From when I probably started working and after graduating college, probably every year, twice a year, I was hospitalized.
Are these hospital stays normally long, like 5+ days?
For me, five days. So on average, I would be in the hospital 5 days. At the 5-day mark, I'm really itching to go home, regardless of how I feel.
You've had enough.
I've had enough. Get me out of here. I'll figure out the rest when I get home. Could I stay longer than 5?
Absolutely.
Yeah, but you just don't want to stay in the hospital, and because I have the less severe form of sickle cell, I think my hospital stays are going to be much shorter than someone who has the more severe version of sickle cell.
Can you elaborate a little bit on that? Because help us to understand what you mean by like more severe, less severe. There's different types.
Yeah, like what are the types?
There are different types of sickle cell, or different variants. One is SS. That's the most severe. So a person would have 2 S genes on their chromosomes to give them SS. I have SC. So I have 1 sickled chromosome and then 1 beta hemoglobin C. So I have a hemoglobin S chromosome and a hemoglobin C chromosome, which gives me SC. And then there are 2 different types of beta thalassemia. I don't know the 2 different types. One is more severe, which mimics the discomforts as SS, and then the other one is less severe. So I guess it would kind of mimic like what SC would look like. But the crazy thing about sickle cell is just because you have SS or SC or beta thalassemia, it does not look the same in every person. So like my mom has SC. I also have SC. Growing up, I never saw her sick, but I was always sick.
Was she sick as a child though?
I'm not sure, but I know my mom, when we've had conversations, she's like, I just don't understand why you get so sick. We both have SC.
Okay.
And I was like, I don't get it either, because I'm always sick and you're never in the hospital. You're never in pain. You never have to do any kind of, you just live your life like everything is normal. And I'm struggling with pain, working through pain management, missing school, missing work, and that's not something that she had to experience.
That's why I had to ask again, because I was like, I think your mom does have sickle cell, but I couldn't remember because she truly just like
lives her life.
Yep.
Yeah.
Did that cause some resentment?
No.
Okay.
No.
Okay, that's a good thing.
Maybe she feels bad because, as in your mom, like
survivor's guilt.
Yeah, like I gave you this. She doesn't have any control over that. But how do they figure out what type it is that you have?
From the pathologists, from the shape of the
No, they just do blood work, and then the blood work determine if you've ever looked at your your blood typing. It'll specify, because when I get blood work done, it'll tell you the percentage of sickled cells that you have. So hemoglobin S, it'll tell you your percentage. Hemoglobin C, it'll tell you percentage to identify that you have SS or SC.
So is it like a sickle cell panel that they do?
No, they just take a regular blood panel. So the same blood panel that you guys would take, they do. They like just run.
Because I'm feeling like I ain't never seen that on none of my blood panels.
Yeah.
Well, they would have to put it in their system that they're looking to test.
Okay.
Makes sense.
So when you are in the hospital, what type of treatments do you get? Do you get oxygen, blood transfusions? What type of pain meds do they use, and what works for you? Because what works for somebody else may not work for you.
So I'm going to say this, and I know this for a fact. For sickle cell patients, the biggest thing is pain management. And unfortunately, the only way to manage our pain is with heavy narcotics. So
absolutely.
Like dilaudid. I'm going to say for me, morphine doesn't even work. Or Percocets, things of that nature. But like dilaudid is the number one drug that works to manage sickle cell pain. And nothing else works.
Do you feel like while you are hospitalized, that any of your healthcare providers, whether it's residents, the doctor, or the nurse practitioner, the PA, whoever, do you feel like you are being labeled behind your back as a drug seeker because you need these heavy narcotics? I mean, they are healthcare professionals. They should know what sickle cell does.
Well, they asking who all over there and when did you get it? As if it's something you just pick up off the street. So I don't expect them to be quite knowledgeable about the pain you're experiencing. And one thing I will say is that even like I've witnessed you going through a crisis, and like I empathize with people, but quite honestly, it's really hard to understand the pain that someone else is feeling. Like you can see it, and you can see, like, let's just say somebody gets in a car accident or somebody like is bleeding, right? Then you're like, okay, I get it. But if it's just like an internal type of thing, you have less of a understanding of it. You're like, are they making this up? That's just in general. Then when you move it to being, most of the people impacted by sickle cell are people of color, they already don't believe our pain anyway. But so then it's kind of like,
they don't have to believe her though. That's the thing.
They don't.
That's the thing. They don't have to believe you. They have a job to do.
They have a job to do.
They have to rate your pain.
But I don't think they understand it well enough to...
There's some good doctors who do understand it.
Feel like...
There are some. But then there's a lot of nurses and from what you tell me, doctors who don't understand it. Talking about, when did you get this?
Right.
Yeah. So I'll speak just for myself that in my history of finding medical practitioners, especially as someone who has sickle cell, I've gone through a lot of hematologists because I just don't feel comfortable. I remember one hematologist, I'm not going to say she's racist, but I just felt like she was judging me. She's asking me very specific questions about drugs. And I mean, I guess, that's part of her job. She has to do that.
Like,
but
what,
I'm like,
do you do drugs?
No, just like my use of narcotics. And I'm like, well, you can see in my history when the last time I asked for pain medication. You're my hematologist. I'm going to you. So you can see when's the last time I've asked for this medication. There's no need for you to... Or maybe I was just taking it personal, and where I felt like she was in a place of judgment instead of just doing her job and asking the right questions to assist me with whatever it is that I need.
Was this an outpatient visit or was she doing rounds?
This was an outpatient visit.
Okay.
Yeah. So.
What's a hematologist? I mean, I know what it is. I'm just saying for the people that watch, listening.
So a hematologist is a doctor that specializes in a variety of like blood disorders. Okay. So, yeah.
So you've gone through many?
I've gone through many. The one that I am currently going through now, I actually recommended him to someone. He doesn't have good bedside manner.
No,
but
I would never make it.
No, okay, he doesn't have good bedside manner because he is a scientist, and so he just
awkward.
doesn't. Yeah, he's just very awkward. But if you tell him like, "Hey, I need X, Y, and Z," he'll listen to you and he'll prescribe what you need. But as far as like being comfortable, being sociable, him trying to get to know you on a familial, it's just not gonna happen.
I would never make it. I need somebody to know my cat's name.
You're not gonna find that many hematologists that are.
I feel like that's such
a
personable like type, because like you need to build a rapport with that person because it's not a one-time visit, right? Like usually hematologists and oncologists are in the same building, and that's a very personal type of visit where.
And you're not coming to them for fun.
If he knows like what he's doing, then you know might could overlook that so that you get the stuff that you need.
I look over it because I look at it as a package. So he works closely with nurse practitioners. Most of the time when I do go to the office, I'm with the nurse practitioners and they are more compassionate and, you know, they're listening. And then they also have a social worker that communicates with the patients. And so that I look at the whole picture, and the whole picture is the team. And then I look at, okay, like,
so he's just a piece of
he's a piece of it, but he's an important piece because he does provide me with the medication that I need. So do the nurse practitioners. If I want the warm and fuzzy, you're compassionate, you understand how I feel, then I'll be with the nurse practitioners. And even then, you know, people are human. They're going to listen and they're going to provide advice and opinion based on their experience, and their experience can be totally different from someone else's. And so even sometimes they might not provide like the best advice or advocacy for what you actually want and need. So it just, you know, we're all human. I try to look at it that way and not like this person is out to get me or doesn't care about me. I know ultimately the team does care about me. And they do care about like, what do I need to live a comfortable life on the day to day? And so I take all of those things in consideration. And because it's not perfect, but it's the best that I've ever experienced in my adult life, it makes me extremely nervous to leave, to like move to another state, move to another country. Because you move to another state. Let's say I move to another state. Let's say I move to a whole new team, and maybe the state in which I live in, maybe they don't have a sickle cell unit. All right, and that's another thing just about New Jersey. I'm the hospital that I specifically go to. In that hospital, they have a sickle cell clinic, and that is the only reason why I go to that hospital, because I know. When I go to this hospital, they know I have sickle cell. They know they're going to give me, typically, they'll give me what I need because they are familiar with the disease. As opposed to, let's say I go to a town of a different demographic that doesn't have a lot of people who have sickle cell. And I'm going into this facility asking for a very specific drug because I know that Dilaudid is the only thing that's going to work. Please don't give me anything else because I'm still going to be in extreme pain. I'm nervous to even go to another hospital because I'm like, will you understand?
No, you'll be labeled.
That I need this in order for me to be calm, to feel normal.
They may want to start you off here with something that you've tried years ago, right? So they may do Toradol. Then they want to give you a PO med oral, right? So then they could give you Percocet. And then they might want to give you Vicodin. And then they might want to give you morphine. And then they want to give. It takes a while. Right. You don't have time for that.
And I have to tell them.
You've been there.
I've had to tell them like, do not give me this drug. They've tried to give me Toradol. I said, do not give this to me. It's not going to work. Do not give me any more poison that I already have to take. Like Dilaudid, yes, it's poisonous. I get it. It's the top of the top, but it works. And it's this one thing that you have to get me to stop crying and to stop being in extreme pain. You give me everything else, you're extending my pain because it does nothing.
You know, I've had a few patients who had certain medications that didn't work for them. They just put it down as they are allergic. You ever tried that?
I've never tried
Just
that.
put it on your chart as you are allergic. What happens? Hives. It won't even be offered to you.
That is, I'm going to try that.
Yeah.
I'm going to try that.
Because why would we offer you morphine when you're allergic? So, like for morphine, I say tell them that your reaction is nausea and vomiting. Toradol, you get extremely itchy.
Okay.
Mm-hmm. Right?
Not telling her that. Well,
yes, I am
breaking the law, but
I
could dig it.
Look, I will try it.
While she's in pain, she shouldn't have to.
Because they're trying to follow a pain management protocol, which really shouldn't apply to this situation.
Why are they giving her PO? Why are they offering her PO meds during a time like this?
They're trying to follow a protocol.
You're gonna wait a minimum of an hour for it to even break down and metabolize and all the other stuff. She needs something straight through the IV.
Because they're not educated, and they also don't understand that you are in a
and they're
great
not
deal of pain.
empathetic, and they're not compassionate.
They're not.
Yeah. Okay. So, does oxygen work for you though in any way, shape, or form?
To alleviate pain, no. I mean, I'm sure it helps
with the
blood cells,
flow.
Right? The blood flow, and then just providing the oxygen to the organs. But with pain, no. But it's it's like that necessary component, just for the overall system. But specifically to get you to not feel pain, it does nothing for pain.
Do you prefer if they give you the Dilaudid, let that kick in, and then give you oxygen? Because who the hell wants oxygen on while they in pain?
I mean, you can give me both. Like, just you have to give me the pain first. Give me the pain medication first, and then whatever else.
Because you probably not even breathing properly. You're probably like holding your breath. If it's anything like labor.
Pain, because when you're in pain, like
I'm gonna say this, I would prefer labor pain over sickle cell pain, and I'm gonna explain why. So, labor pain, you get breaks. I always explain this to other women who've had kids. I said, you get a break. Even if it's down to the very end, you get a second break or 5-second breaks before the next contraction, before the next wave of pain. Imagine having contractions without a break for 5 days straight or for 7 days straight, 24/7. That is the closest thing I can tell you to what it might feel like. The contractions don't feel like sickle cell pain at all, but just like the severity of pain and how long you have to endure it. That's the closest thing that I could say.
Not only that, labor pain is normally within this area right here. Normally, right? Sickle cell is systemic.
Right. It's everywhere. It's wherever.
You're feeling this everywhere.
Yeah.
What usually causes a crisis?
Like what induces it?
Yeah, like not only the things that can cause it, but what is happening biologically to cause it.
Okay, so triggers. So I would say the number one trigger is stress. And I know everybody's, stress kills. Well, stress causes a lot of negative side effects. Just in an average human that you probably wouldn't make those connections. But specifically stress, it can trigger a sickle cell crisis. So that's number one. And now I'm talking about your everyday stressors. So it could
be work, bills.
It could be work, it could be bills, it could be relationship stuff.
Just any stress.
Any kind of stress.
Straight to the right by the front end.
So that's the number one. Stress is the number one. The number two would be, I would say, cold temperatures. So it could be weather temperatures. It could be too much air condition. It could be cold water temperatures for like a pool or a beach or any kind of cold temperatures that can automatically trigger a sickle cell crisis.
How about from an airplane? Has it ever triggered it for you?
I normally close the vents. So I close the vents and I always bring a sweater.
Okay.
So, those are the things that I always travel. I make sure that I have that. And then, I'm going to say this, coincidentally, because of COVID introduced masks, which I would have never used in the past, but I feel like for sickle cell patients, like it's an important component just for overall just traveling or working within certain environments, because it limits your exposure to diseases or, you know, infection that causes stress to your body. And then even when we get sick, we wind up being sick much longer. So let's say you got a cold, right? How long would it take you to recover from a cold?
Girl, you don't want to ask me. About 7 to 10 business days.
Okay.
Maybe more.
Okay.
Maybe more
To fully recover.
Girl, I'm a bad example. You want to ask her that question.
Okay. Jazz, how long does it take you on average?
I can't remember the last time I got a cold, so I don't even know the answer to this.
But for me, about 7 to 10 business days.
Yeah.
Okay. Well, I'd probably say most people probably like 3 days. 3 days, they're, you know, can be back to running. For me, if I get a cold, I'll feel back to close to being 100% 3 weeks. Right. So 3 days versus 3 weeks.
So it knocks you off your feet.
Right. So even I had caught COVID. What was that? That was in 2022. I think I caught COVID. I caught COVID, and then I caught something. I was sick for about a month. Between COVID and whatever else I had caught, I was sick for about a month. So, yeah, like wearing masks is something. At least when I go on airplanes, I'll make sure I have my mask.
So do I, and I disinfect.
Yeah, they gave those alcohol wipes. I'm like, thank God. Girl, I just wipe up everything.
Take bleach wipes.
Yeah, clean it up. Yeah. Between that, wearing the mask has been very helpful.
Because people are disgusting.
They are very nasty.
They really are.
You know, they're circulating the air, and even before COVID, certain airlines, I would get sick all the time I would get some sort of like viral infection after getting off an airplane. Now I'm like, I'm just gonna wear this mask to keep me healthy and protected.
Breathe my own air.
Smell
my own Chipotle bread.
Yep.
Oh, Chipotle. I just went to Columbia, South Carolina last month, and me and this Asian guy were the only two people on the plane with a mask going. Yeah. Coming back, I was the only one with the mask. Yeah. And they were looking at me like I was crazy when I was disinfecting everything.
Yeah.
It's still out on these streets. I need them to understand that.
Yeah.
It is. It is.
Then I would also say, so the extreme of temperatures, if it's really cold, also if it's really hot. The heat, not so much doesn't necessarily affect me, but what affects most people with sickle cell is dehydration. So like when it's extremely hot, in general, we need to make sure that we stay hydrated, but in extreme temperatures, hydration is really important, because if you're not staying hydrated, you're putting stress on your body, and that then triggers the sickle cell crisis.
So this is for everybody, or do people have different triggers?
This is for everyone. So it's stress, extreme cold, extreme heat. Okay. Those are like the main triggers to put someone into a sickle cell crisis, and everybody has different ways in which they will prepare to avoid a crisis. But yeah, those are the top triggers for sickle cell.
So the actual cells, because the way I envision a crisis is that the actual cells are trying to pass through as they normally would, but they get stuck and they're like in a clump.
Yes,
and so that's what causes the pain, because they can't bend like they're supposed to.
Yeah.
And so it's just like I can just like imagine it. Sounds painful.
Yeah, I would say the closest similarity in pain would be like back spasms.
You ever had a kidney stone?
I've never had a kidney stone.
Ooh, or a gallstone. Yeah, either one of those.
But you know, like the throbbing feeling of a back spasm, that's how it feels wherever it is in your body. But imagine that in your bones. If you could imagine that.
That's awful.
So that's what the pain feels like for me. That's the closest thing that I could compare it to for any, average person. Because, as you get older, your back blows, you get back spasms. That is a more common feeling for an everyday person to experience than sickle cell. You just will never know what the pain feels like until you've experienced it.
It sounds very inhumane. What is my next question? I wanted to know if you ever get painful swelling of your hands and feet.
So I have never gotten painful swelling of my hands or feet. The only time that I've had swelling in my feet, one was I was on a plane going to vacation, going to South Korea, and at the end, I think that was just because of I was on the plane, right, and my feet swole up.
Did you have on compression socks?
I did not, because I didn't know anything about a compression sock then. Yeah, that, and then pregnancy probably was the only other time where I had swelling. But on the everyday, no, I don't experience it.
And you mentioned medications before, that the hematologist gives you the medications that you need. What would you like to share some of these medications that you're on, and what is it that they do for you?
So I don't, as an SC patient, remember I'm less severe, and just because I'm SC doesn't mean that my treatment plan or management plan is going to be the same as another person who has SC, and definitely not the same as someone who has SS. But all I have to take is 1,000 milligrams of folic acid daily.
Okay.
I have diluted 2 milligram diluted pills at home if I need it. So if I'm gonna manage pain at home, I have that. And then the other, I wouldn't necessarily call it a medication.
It's a vitamin.
It's a vitamin. It isn't for sickle cell, but it is for a condition that I got because of sickle cell. So I have to take calcium and vitamin D. And I have to take calcium and vitamin D because I have something called avascular necrosis, which is bone cell death. And essentially the bone cell death is occurring in my femur bone, not my femur. It's in my hip, the ball of the hip socket.
Oh my God, so painful.
So what I think happened was when I was pregnant with my son, right before giving birth to him, I had a sickle cell crisis.
Oh, you just answered one of my questions.
All right. That's what caused me to go to the hospital before having him. Like I wasn't having contractions or anything. I was having a really bad sickle cell crisis. The pain was in my right hip. So I went to the hospital for pain management for my hip. And normally when you're pregnant, they say no medication, you're not supposed to give anything. But when you have sickle cell, they prioritize the mother's health and the condition over anything. So if you need pain management, so I needed diluted in the hospital, they're going to give me diluted in the hospital. And so that was able to, once I got the diluted, then the pain goes away. So again, it's in my hip. So I wasn't able to walk. When I was in extreme pain, I had to have one of my friends come into my home to carry me to her car, to take me to the emergency room. They had to wheel me in a wheelchair to the front desk, and then wherever they needed to take me in the hospital because I couldn't walk. I couldn't walk. And so once I got the pain, the medication, the diluted, the pain goes away, but you still can't walk because the blood clot is still there, right? And so the blood clot is in that area, which is by my hip bone. No blood flow is going there.
And right? That's how you got the cell death.
Oxygen is going there, right? And so then the blood cells that were providing oxygen and blood to, I guess, that portion of the bone, they die and they don't reproduce.
That's a necrosis
part. And that is the necrosis part.
That's the necrosis part. Go ahead, girl.
So the bone is breaking down. And
now, currently,
and so at some point, I'm going to have to get a hip replacement. And I've been going through this since 2018, so for quite a long time, which is it's pretty good. And I'm happy for it because my hip hasn't collapsed yet. And on average, they say, like once you are diagnosed with it, it usually collapses within 2 to 4 years. So
Oh my God.
I'm well past the 2 to 4 years. So I'm like, look, let's keep pushing. Come on, body, keep working as long as you possibly can.
You said calcium and D3.
Vitamin D.
Okay.
Mm-hmm.
So you said folic acid as well. So have you ever heard that we cannot really process folic acid in the oral form unless it's methylated?
Oh, no.
Folic acid, that, no, because that's what I've heard. So if you're taking folic acid orally,
a lot of it.
Yeah, sounds like a lot. That really only, I know when you're pregnant, you're told to take that because it helps, right? But what through different research that I've done because of the surgeries that I've had, your bones, because you just don't absorb vitamins in the same way. I also have to take calcium with D3. It also has magnesium in it because it helps absorb it better with those things combined. Mm-hmm. That's why the D3 just combined with the calcium. Oh. It helps to absorb it. Sometimes they combine it with K2, which
I've seen that.
Whatever, guys. But the methylated folate, apparently you absorb it a little bit better. But I think that those things that you're taking are definitely helping to make your...
Now, is the folic acid that the doctor prescribes, is that different from...
Yeah,
oh,
yeah.
Is it... Oh, so it's not... The ones that the doctors prescribe is not methylated?
I don't think so. According to...
So where do you get the methylated one from?
I don't know, China.
She said China.
I don't know. I'm just going over what I hear. It's actually a pharmacist that I follow. I think his name is like Phil, the pharmacist, or whatever. He's like, a lot of people don't process folic acid the way that we think we do. So it may not be as effective. But if your regimen is working,
1 milligram a day. 1 milligram a day. I think that's probably average for most sickle cell patients. The norm is like what, 200 micrograms or something?
Yeah, or 400, right? Isn't it 400?
Don't give me the line. I don't know. Especially now, I don't know.
I have to take 1 milligram daily, and then I have one other medication that I've been taking because it's not because of the sickle cell, and I've been taking the calcium because it works in conjunction with the medication that I'm specifically taking for my hip, and it's a medication that's given to osteoporosis patients called Fosamax.
Oh, I've heard of Fosamax.
And so Fosamax, there have been some studies that have shown progress in delaying hip replacement. Yep, because of that drug. So the doctor that I'm going to, I think I'm the first sickle cell patient that he is providing this treatment to. And also,
sounds expensive.
Well, no. Well, with my insurance, it would have been like $70 for a month. But I don't have prescription insurance, whole different ballgame, and it's not that expensive with other sort of like subsidies that you can kind of figure out.
Good RX,
but
those things.
Yep.
Yep. Sometimes those coupons be better than the insurance.
It's way better. No, yeah. It's way better.
He's struggling.
Yeah.
Okay, well that's interesting.
So with all of these different vitamins and medications that you are taking, does it cause any stomach upset?
No.
Do you make sure that you eat with it or not necessarily?
Well, so with the Fosamax, the way that they tell you to take the drug, you take it it's a pill once a week. You take it with just water before you eat anything. You can't eat until 30 minutes after.
Okay.
So I do that.
So it probably is better absorbed on an empty stomach.
In order to get into the bone.
Yeah.
So quick question. With all these, and this is kind of not as clinically detailed as those questions, but kind of relates to what we were talking about earlier. With the medications that you have to take in the event that you have a crisis, how is dating? Like, how do you approach dating?
For a long time, I don't think I would. I would wait to tell people that I have sickle cell, and then even then when I did tell people I have sickle cell, they didn't understand. So they're like,
Yeah.
"Oh, what's that?" And I would explain what it is and explain.
These are Black people.
These are Black people.
They
Yeah,
don't
Black
understand.
people.
Okay.
Yeah, so they don't understand. They just listen, and it's like, "Oh, okay," and that's it. But because I don't have crises as often as others.
Mm-hmm.
I'm able to have a social life. You know, some people have crises every week.
Oh my God, there's
You
no way
know?
to live.
Right. So I'm sure they might have a more difficult time dating, trusting people, opening up, you know. But it didn't have a huge effect on my dating life, but you know, I have gotten into I've had crises while being in relationships, and you know, the guys kind of step up and they help.
Mm-hmm.
And so they're like, how can I help? Do this. And you know, they do whatever it is that I need, and then once it passes, that's it. Life goes back to how it was before.
Mm-hmm. Have they ever stressed you out to the point where you went into a crisis because they stressed you out?
No.
Or is it more so just life?
It's just life.
Right,
yeah.
Because
It's
what we
life.
don't need is
Right.
them being over here stressing you out. They're supposed to be relieving your stress.
Relieve it, right.
All right. I'm just making sure.
So, minus you going into the hospital right before you gave birth, how did pregnancy affect your sickle cell? Did it?
I'm going to say I was super excited when I was pregnant because my hemoglobin levels were at its highest.
Oh, so it kind of put you into remission during your pregnancy?
I didn't have any crises while I was pregnant. I only had the crisis at the very end.
Mm-hmm.
But all before, I felt fine. I felt, I guess, like how most pregnant people feel.
Nauseous.
Yeah, nauseous in the beginning, and then I mean, I was very active. I exercised. I was a rugby coach for a school in Brooklyn, so I used to commute from the school I worked at in Manhattan to go to Brooklyn to coach rugby, to go back to New Jersey.
Oh, you just had a cape on your back.
Run up and down the fields with the girls.
Maybe you induced this hip issue.
Look. No, but yeah, at the very end, I don't know, but my hemoglobin levels are normally around a 10, and the starting I guess rate for a normal hemoglobin level is 13. Mm-hmm. And so I think I was at a 13. I was like, oh my gosh, I got a normal hemoglobin level. This is so exciting.
I'm normally at a 10 as well.
Oh, yeah?
Especially now. Yeah. And then like low. It always comes up like red in my results.
Yep. So it was at its highest. I felt really good. I didn't, I felt really good during my pregnancy, and I'm always tired, so I don't know if I was more tired. I don't remember.
During the pregnancy.
Yeah, I don't remember, but I'm always tired, and that's like consistent with a lot of sickle cell patients. Mm-hmm. We're always tired. And I didn't realize that until like later in age, that mm-hmm. when you are allowed to get adequate rest, you can feel how it feels to not be tired instead of the everyday. I just figured, you work every day, hustle and bustle, you feel tired. Everybody feels tired. Mm-hmm. Yeah. But talking with other sickle cell warriors, we're just really tired all the time. And the amount of rest that we need is way greater than someone who does not have sickle cell. And when you allow your body to get the rest that it needs, it helps to protect you from getting sick.
Yeah. Well, what is the life expectancy? This sounds bad, but I do have members of my family who unfortunately have passed away from sickle cell. Not at a particular age though. So there's one that passed away when they were 18. Then we have some that lived well into their 70s and some into their 30s. So it's different for everyone. But like, is it dependent on the type that you have, or just like how you manage it?
Well, I would assume that people with SS have a shorter life expectancy than SC because they go through more sickling, more crises throughout their life. And so I remember at one point, I was just really afraid, and I was just like, I think I'm going to die before 50 because we cannot control where the crisis occurs. And like the last crisis that I had was so bad. It was the first time I had a crisis and almost every limb of my body, like my chest hurt. I think my right arm hurt. Both of my legs hurt. I think the only part of my body that didn't hurt was probably this left arm. And
does your face hurt too?
I've had a sickle cell crisis in my jaw.
Oh my God.
The first time I had one, I went to a dentist because I was like, my jaw really hurts really bad. Jesus. And they did an x-ray. They're like, nothing's wrong with your jaw. And they were like, have you ever had a sickle cell crisis in your mouth? I'm like, no, I didn't even know you could get that. And they were like, it probably is a sickle cell crisis. So like I went home, I took some Dilaudid.
It knocked it out?
Yep. Dang.
Jesus Christ.
Yep. And so I've experienced that twice in my life so far.
Do you still feel like you might die early?
No.
Okay, good.
I feel like I can.
You're managing.
Hopefully, live to be 86.
Why 86, girl? Push it further.
I've read an article and it was like a lady who had sickle cell and she was 86 years old. I was like, oh, maybe I could live to be 86 one day. So that's like that's the goal. Like live to be 86. I can make it to my 86th birthday. God can take me after that.
So. Very specific.
Yeah.
Is sickle cell a disease that qualifies people for disability if they can like no longer work?
Definitely. It definitely can qualify you for disability. In my work experience, at least me having SC, remember I said, I would be hospitalized. I was hospitalized twice a year from when I started working until about 2020 or 2019, right? When I'm hospitalized, I'm in the hospital for minimum 5 days. But at the 5-day mark, I'm ready to get out, but by like the third week, I'm telling myself like, oh, I have to go back to work. I have to go back to work. Am I ready to go back to work? No, I'm still in a lot of pain, or I'm still in pain. My body is really weak. I'm able to do some things for myself, but I'm not like a functioning human being. I would have to go back to work. Oftentimes I would go back to work medicated, taking the Dilaudid.
Oh no.
Going to work.
Driving?
No, not driving. Taking public transportation, but taking the Dilaudid to go to work because you have to be able to manage the pain with a heating pad or some sort of like heating compress on my body throughout the day just to make it through the day. And I'd have to do that for at least a week. But, every time you get sick, you don't want to take a month off. And you feel like your employer is going to pass judgments on you because you're taking so much time off. And eventually, they will. I've had to apply for FMLA just for protections because I'm like, look, you can't get rid of me because I'm sick. Like, I can't help that. And this job makes me even more sick. So I can't help that. So I need to put this in to protect myself. I don't care if you don't pay me. I just still need my job. So when I come back, you will pay me.
Right. Was there ever a point where you ran out of sick time and you just had to take no pay?
I didn't have to take no pay because where I worked, they had once you ran out of your sick time, you then could borrow up to a certain number of days.
So were you always in the negative?
I was always in the negative.
That's what I wanted to know.
Until COVID. And then I was excited when I had 4 days. I was like, woo, I got 4 days. And everybody's like, what's the big deal? I'm like, you don't understand.
Okay, so after COVID, then you got some days in the
Yeah,
bank.
I got some days in the bank.
Okay. I wanted to know how did pregnancy affect your sickle cell, but you already answered that without me even asking. So kudos to you.
You did ask it.
No, she didn't.
Are you here?
I started, and then she's like, "Oh, I don't even have to answer that. Ask that."
Okay. So
am I here?
You are here, but are you here? Okay, so what are 3 facts that you would like to share with us about sickle cell disease that we may not know? And this is something that the healthcare providers might not know, like just something from within that you would like to share with us about sickle cell disease so that you can help us all to be more aware. Even if it's just advice on being more compassionate or asking questions, just anything, just 3 things.
Well, one thing I'm going to say is this is everyone. It can be a medical practitioner, family member, friend. Do not look at sickle cell like any other disease. It is very different. I could be having a crisis right now. You would not even know. I'd look normal. You can't see my pain. As you guys said before, like, if somebody had a wound, you can be more compassionate. A sickle cell patient can be in extreme pain. They might not cry. They might be silent. They've been dealing with this from birth. Right. So if someone is coming to you saying, I'm in a crisis, take them for their word. And the only thing that works is narcotics. That is the only thing that works. I know, other diseases you can give
Toradol.
Toradol, whatever kind of treatment, and it will help manage the pain. It does not work for sickle cell. It does not work for sickle cell. Unfortunately, it is what it is. We need this type of pain management, and you just, as a medical practitioner, just please understand that we're not out here seeking drugs. This is the only thing that will help us alleviate our pain. And many of us wish we didn't even have to take it.
Exactly.
We wish we did. A lot of
people say that Dilaudid makes them feel so nauseous.
It makes me feel so bad.
Yeah.
It really does.
So then you're in a situation where, do I want to feel sick or do I want to be pain-free?
Right.
So you got to pick your bad.
Right.
Because there's no cure for sickle cell. Let's just be like real clear about that. There are ways to manage the condition through the pain management and vitamins and supplements and all those things. But there's no cure, and I mean, there's newer things that have come out now, but that's really your options to manage.
Well, now, okay, there's this debate or this conversation, I'm going to say, in the sickle cell community on if gene therapy is the actual cure for sickle cell, because it has brought about some success in patients who have gone through gene therapy or who have gone through bone marrow transplant, and now they live sickle cell free. They might have
in remission.
No,
really,
it's
so
just
all the sickle cells are
gone.
They like completely flush them out, and
right.
Then
and so if they do a blood panel and they test to see if you have hemoglobin S, hemoglobin C, or hemoglobin, 2 SS's or whatever hemoglobins are specific to theta beta thalassemia, nothing.
Wow.
So
that's
on
amazing.
a biochemistry level, it records as not being existent, and then just the actual person, they're like, I don't have sickle cell pain anymore. I don't have to take the medications that I may have had to take in the past. So like, I don't have to take hydroxyurea. That's a common medication that's given to sickle cell patients. My doctors have asked me in the past, like, are you interested in taking hydroxyurea? And I'm like, what are the side effects? Well, how often do I have to take it? And I just didn't want to take it just because I said, I don't go through crises that often for me to want to take this medication that could have tons of negative side effects. So I'm just gonna do whatever it is that I'm doing now. But other sickle cell patients have tons of other medications that they have to take on a day-to-day. Some people get prescribed like 90 pills a month of Dilaudid or whatever kind of drug because they need it to manage their pain at home because they experience crises way more often than like me. But people who have successfully gone through gene therapy and bone marrow transplants,
they don't need any of those things.
Nothing. Yeah, they live a life as I would say, a regular person.
Are there times you're able to manage your crises at home without going to the hospital?
Yeah, so when I have sickle cell crises, typically I either have them in my arms or my legs. The last time I had it all over, that was like my first experience having it in so many places at one time. If I have a crisis in my arms, I can manage it at home because I can still walk. I can still go to the bathroom by myself. Usually it's in one arm. And so if it's in one arm, I at least have the other arm to like heat up water if I need to, get myself some food if I'm hungry, or just try to stay as hydrated as possible while I'm home. But if it's in my legs, I'm automatically in the hospital because I can't walk. I can't help myself, so.
Oh my God. Excuse me. 2 questions that I have for you. The first one is, what is the first one?
Only you will know, sweetie.
Do you qualify for gene therapy? That's my first question. My second question is, do you have a plan in place because you have a young son where when you need to go to the hospital to be admitted for treatment, do you have a plan in place that kicks in immediately so that your son is okay?
So I'm not eligible for gene therapy because I have the less severe form of sickle cell. Gene therapy currently is only available to SS patients, and then the beta thalassemia, that's more severe.
Worst.
Yeah. So it's only eligible for those. It's not eligible for SC patients now.
As of yet. Maybe things will change.
Because this is very new.
It is very new.
It's like, I started hearing about it like last year.
Yeah.
And I mean, it's probably good that they have something for the people who suffer the most first, and then they can focus on like the SC.
Yeah, but as an SC patient, it's like, even though I'm not having a crisis every week, I would want to live life without a crisis at all. Nobody wants to experience any pain. Now, if you lived with sickle cell and you didn't really experience pain, then it's not something that you're even thinking about. But those who go through crises more readily, like even if you have SC, this is something that you would prefer to live without.
Have you heard anything about them doing research so that the SC patients will have some type of gene therapy?
I haven't heard anything yet. I don't know if it's in their maybe it's in their plans. I'm not sure, but I know they've done several tests on SS patients and the more severe form of beta thalassemia. So
we're almost done.
So my plan for whenever I do get sick and I do have to be hospitalized, I have a really close friend. If I can't walk, she's usually the one to take me to the hospital. And then the plan that I kind of have set in place now is if I were to get sick, she would have to take my son to stay with his great grandmother because she would be able to take care of him during that time. Or
his great grandmother?
She lives in New York.
Okay.
Or I would call my mom. My mom lives all the way in Virginia, and if she's able, she could drive up and help.
So now your great grandma lives in New York. So his school is in Jersey.
Yeah.
So then when you're hospitalized, he would have to miss school.
So the last time I was hospitalized in 2022, my mom was still living in New York, so she was still working. Yeah, she just took off work and she came to my house and she, handled things, took him to school, and it was a huge help. And after that, once she moved, I was scared because I was like, well, what am I going to do next time?
Support system.
Yeah. I was like, what am I going to do next time? So she was like, okay, well, we got to brainstorm with the options that are available. And
does he take a school bus?
No, we walk.
How far is the
walk? About half a mile.
Then you going into great detail about this part.
Because I want to know if great grandma could come to because somebody go get her and bring her to the house for her to stay there with him, and then
she could. They could if she was willing to do that. Yeah.
Okay. Oh man. So that's another stressor, right? Yeah. While you're trying to recover, now you don't want to pull your baby out of school, but you might have to
do what you got to do.
Yeah.
Do you feel like as you've gotten older and more knowledgeable about your triggers and your body, that it's gotten better for you, or different?
I think it's gotten better only because I put up more boundaries for myself. And I'm not willing to go out of my way because my health is more important. So if I'm tired and I tell someone, hey, I know I said I was going to come out, but I'm not coming. I'm tired. I don't go into explanation. You're not going to understand. You're going to just think, oh, my tired is your tired. It definitely isn't. You're not going to understand. I'm not going to go into detail trying to get you to understand because you don't live in my body. So I'm very firm on like how far I'm willing to drive and how often I'm willing to do that, because I understand that all of those things build up a stress,
whether it's physical stress,
or mental stress, or all of it adds in together and has a negative toll. And stress doesn't affect me the same way it affects you guys. You guys can be stressed and you can still live your day to day and not be in extreme pain. I experience stress and it puts me into the hospital, and so
I like the fact that you're not being phony about it. You just like, I'm not coming because I'm tired. I'm sure a lot of people take it as being flaky, but the people who are near and dear to you, I'm sure that they understand.
Yeah.
And that's all that matters. And if they don't understand, you don't have the strength to care.
Yeah.
Right.
That's
it. They are going to be the ones that have to deal with being in pain, being in a crisis, and losing out, and then that being in the hospital for 5 days, and being out of commission for 3 weeks, and being all those things.
Right.
So,
and that's also stressful, right? Being out of work for all that time, and then having to borrow time that you don't even have yet. Like that's all stress. Trying to figure out, am I going to have enough to cover my bills? Like,
Yeah.
All right, well, that's all the questions that I have for you. Jasmine, do you have any more questions for Tiffany?
No, I just think that what people need to understand is that this does primarily impact people of color, so African American or people of African descent. Does it impact like our Latinx
people
as well, right? Yeah. Okay, so
it affects people of a specific region, so it does become it is prevalent, right? So sub-Mediterranean, so that
because I've heard of white people having
Italians, Greek, right? It came into existence from the Mediterranean region, but it is more prevalent in Black people. Black also extends into the Caribbean. It also extends into South America. So Brazil. This is
so in my family.
Yeah. So from European countries, African nations over to the West, it's going to affect that that demographic of people.
Yeah, that was the only other thing. And then the recent Netflix show Supacell.
It's really good. If you haven't checked it out, make sure you check it out.
Yeah, we're not getting paid by them. But
yeah.
If we can get paid by them, let's hook that up. But really puts a highlight on not only the sickle cell disease, but also the family aspect of it and how they care for their family members is a big thing that I saw. Like the care and concern that they have to put forth. Even into getting them into that program and into that facility, which is quite nice, I must say. If that's a real thing, can you please let us know about it? Unless you're trying to I don't know, in that facility, harvest my cells and kill me. Don't. But it looked like a spa. It looked like you get the dilaudid on demand.
Right.
Get a pedicure.
Get the dilaudid on demand. Honey, when I tell you they had robes on and the lady just looked so peaceful.
Well, they do have sickle cell clinics around the nation. Like the hospital that I go to has a sickle cell clinic. I've never been because it's in New York and I live in New Jersey. So if I'm sick, I'm not driving across the water. I'm not going to make it. But if I lived close, then I would be able to go to that clinic. I don't know what that clinic looks like, but if you go to that clinic, they do provide you with hydration. So they give you IV fluids, and if you need pain management, they provide that to you in the sickle cell clinic, and then you go home. Yeah. But I don't think it looks like the Supacell clinic.
That looked deluxe.
I'm like,
it sounded like they were with the upper crust.
They had they were one step away from having cucumbers on their eyes and the face.
Right. It sure was.
I said,
well, Jasmine, you're going to have to give me your Netflix password because I ain't got it.
Because when we were working at when I was working at the former employer, they were talking about setting up a clinic, but more so as a subset of the ER, not like a facility that looked nice or anything like that, but just so that you know who the patients are, what works for them, their protocols, you already have them in place, like standing orders in place for that patient, more so that as opposed to like the spot situation that was going on in Supacell. But that would be nice if they had like facilities where you could just, and again, you can't predict when you're going to have a crisis, but maybe you feel a little dehydrated. So, and that's a trigger. So you just go in and get some fluids.
They have, I've been noticing certain areas, they have IV, like hydration places.
Oh,
and I was just like,
I frequent them now.
I was like, I wish my insurance would cover this, because anytime I felt like I needed it, I would just go, but I don't want to pay. I don't know how much it costs, but I don't want to pay out of pocket.
So sometimes your insurance will cover it, right? He's been frequenting them. Sometimes your insurance will pay for it. Your doctor just has to order it, and it comes through a company, because I had it twice. And sometimes you can get like a Groupon to go to these places too, so you might want to look into that as well. But usually those cost maybe $100 per session.
Okay, that's what I figured.
Yeah, or more sometimes, which is like the more no, I'm not paying that. But you'd be surprised how much a little bit of like a bag of fluid would do for you.
Yes, especially people with sickle cell, because the hydration is really important. It helps to get everything flowing. Yeah, so
that's interesting. I never really knew that.
I feel like these hospitals have sickle cell protocols that are generalized or systemic within the organization. But I think that if each patient could have a sickle cell protocol that is individualized, like what works for that patient, I think that we would have less ignorance on the floor.
Absolutely.
When it comes to the doctor, patients.
Do you mean like a sickle cell patients walking into the ER with their sickle cell pain management plan?
Kind of like when you're pregnant and you have a what is it called? Yes, and you have like a birth plan. And so for me, it was in my chart ahead of time. If patients could have a sickle cell protocol that's in their chart,
well, they do
at their hospital, and this is what works for that patient, like for you.
They do. But see, the doctor that I see, they have my, care management plan within their system, but I never go there to go to the hospital because it's in New York. And so I go to the hospital that's within my town in Newark. And so they don't have any records. The only records they have are whenever I go to the hospital in the ER. That's all that they have from me.
So you don't have any type of specialist there? Or anything?
No.
What they need to do is record that, right? So the next time you come in, they know. Or maybe,
because you do have a chart there now,
right? We can create like a sickle cell patient card, where every time you go in, you just hand them a little card saying like, "This is my protocol."
Will they pay attention to that though? Because I was going to create one.
Yeah,
they will.
Yeah.
During your admission process, or
like these are the meds I'm on. Triage. This is what works for me. I've had sickle cell for
because I feel like even in some of the experiences in the past that I've gone to the hospital, and they asked. The last time I went to the hospital, and I was crying the entire time I was there. As soon as I saw the doctor, he listened right away. I was like, thank you. He's like, what do you typically take and how many milligrams? Told him right away. Mm-hmm. That's what he ordered. And my pain went away right after that. And I was quiet.
But how long did you have to wait to actually see that doctor? That's the thing.
That part.
Did you have to wait until he did his consult?
No. So I was waiting in the... No, I was waiting in the waiting room of the ER. I was so upset. I was there for like 2 hours waiting in excruciating pain. I'm like, they're like, there are no rooms. I don't care if there are no
rooms. Bring
the
medicine out here.
I said, roll me in a wheelchair, put me in a corner, and just please provide me with the medication. I don't need a room. I don't need to be put in a room. I'm in a lot of pain, and I just need you to help me right now. Help me, and then you can figure out where you want to put me after you help me. But just help me right now. And
so did the doctor come out to the waiting area?
No.
So you didn't see him until you actually got back there?
Until I actually got back there.
So they left you for dead.
I felt like I was gonna die. I literally felt in that moment, I was like, I'm gonna die in this waiting room.
So you think that you felt this more so throughout your body this time because it was so long without any type of relief?
Know.
Because do you normally get relief faster than the 2 hours?
Yes. So normally when I go to the hospital, when I go to this specific, I don't know what happened that time, this specific hospital, I go there, they tell them, okay, sickle cell, I'm in the back right away.
There's certain things that you say where they are like, oh my God, chest pain, can't breathe,
chest pain, entire body. And I'm like, my chest is hurting. I was like, my limbs, I cannot walk. I was just like, just wheel me there, put me on the corner and just give me the medication. And then you can figure out everything else that you need to figure out. I'm going to be admitted into this hospital anyway.
Right, I already know that.
Yes, I already know that because I'm in so much pain and it's not going to go away just for you giving me IV and pain medication for the 1.5 hour that is going to last. I'm going to have to be admitted. That's it.
Wait a minute. So you get dilated every 3 to 4 hours?
Every 4 hours. They are like, you can't get another set until 4 hours. But the last time I went to the hospital, they put me on this machine.
PCA pump?
Yes, they put me on a PCA pump. And that was my first time, and they had to figure out the adjustments for the medication because what they had me on, I was like, I'm in extreme pain.
So they didn't have you on enough.
Yeah. And then, the doctors kept coming in. I was like, look, I don't know, whatever it is that you're doing, it's not working. I'm still in extreme pain. They're like, but this is a high dose. I'm like, I don't care what you think. This is not working. And then once they put it in an appropriate amount, and I don't even remember what that amount was. I wish I did because that is important.
Well, tell them to check your chart. Mm-hmm.
I was like, next time, whatever the dosage was and the frequency, that's what I need because that is going to work. But also, that was the worst crisis that I had ever had. Yeah. My entire body was hurting and I had never had that before. I would only have at most 2 limbs hurting.
Normally, when you get discharged from the hospital, do you have to go home on oral Dilaudid?
Yes.
Yeah? Okay.
Yeah.
Okay.
Yep.
Oh, boy.
Yeah.
All right. Anything else, Jazz? Or anything else that you want to share before we wrap it up?
In communication with other sickle cell warriors, we've been discussing how much sickle cell plays a role on our mental health, and that's something that people who have disabilities, I don't really think they think about how their mental health connects with their physical health.
Absolutely.
And we've been making that connection that a lot of sickle cell patients are depressed.
Yeah, because look at your quality of life.
But we don't even know. For a long time, I had been depressed, and it's because of all of the layers, all the things that you're dealing with, whether it's in your personal life, dating life, but then just overall health and how that affects your professional life and how you show up in the world. And, even some sickle cell patients who are sick often, they want to be able to contribute more and to work more and to develop themselves professionally, but their health situation limits them from being able to do that. And that plays a big role on higher depression rates and anxiety. Oh man. And, it really has a large effect on your mental health. And that's any kind of disability that you have, but the mental health component really does affect. It's a stressor, right? You go into mental stressors about your job or this relationship, or I'm not going to be able to make it to work. I've been out of work for 4 weeks already and I don't have any more days. Oh, now my kid is sick and I don't have any days because I was already in the hospital for 4 weeks and now I have to take off more. I don't have the money to do X, Y, and Z. Like, all of these things play a role in a person's mental health and then triggers the physical, disabilities that are associated with it. So, have a lot of compassion, ask questions, And even sometimes, the questions that you may ask, every question isn't a smart question. I was just, a good question to ask. Some questions are, there's some ignorance and bias behind it. And so just be aware of what you're asking and also just be open. If that person doesn't want to, answer your questions, you have to be open to that as well, because the experiences that we experience as sickle cell patients it's going to be vastly different from someone who does not have a disability and does not understand the complexities of a life with a disability.
Mm-hmm. Absolutely. Wow. Well, I hope that you remain healthy. I'm putting into the universe that we rebuke you, sickle cell crisis, in the name of Jesus.
Mm-hmm.
Rebuke it.
That you live past 86.
Mm-hmm.
Yes.
Yeah. Look at you making it to your 87th birthday.
Look.
So you put it into the universe.
Put it in there.
Yes, and I'm glad that you are living a mostly stress-free life.
Yeah.
Currently. And I'm just happy that you came and you shared your story with everybody, and you also educated us as well.
Yes, thank you so much.
Thank you for being a guest on our podcast, or as Aunt Lisa calls it, our show. All right, Jazz. Anything else? That's it?
No, that's it.
Well, tune in next time for more snitching.
Yes, thank you.